Okay, today is week 4, and today we're going to go over an eyebrow lift and then micro needling, and then we're going to go over employee discounts and touch-ups today. Okay, so we're going to talk about the different types of eyebrow lifts. The muscle that we're treating whenever we're doing an eyebrow lift is going to be orbicularis oculi. So that's that circular motion that goes all around the eye. It also extends into the eyelid as well. So what's interesting about an eyebrow lift too is what we actually used to do back in the day is whenever we would accidentally cause a true lid ptosis, we would actually put Botox into the lid, very superficial injection, and that would actually help lift it up a little bit. Obviously, it is a really advanced technique because you don't want to accidentally hit the globe. So what we have kind of reverted to now as the gold standard in the industry is going to be the Upneek eye drops. Those work directly on Mueller's muscle to lift open the eyelid temporarily. It only works for around 6 to 7 hours or so. But if a patient has a true lid ptosis, it's something that you can give them just so they can kind of go throughout their day and not have their eyelid droopy. The ultimate fix for a lid ptosis is going to be just time, toothbrush, or the Upneek eye drop. So that's truly how you treat it. But whenever you're initially treating a patient and they really want to have that like opened up look, we're going to be focusing on treating the orbicularis oculi. And there are 2 types of eyebrow lifts that you can do. You can do a lateral tail of the eyebrow lift, and that will give that more of like a cat eye appearance. But you can also do a more medial eyebrow lift, which is going to be about 1 centimeter in from the lateral tail of the eyebrow. And that will give you a different type of look. Some patients who are naturally really hooded, I will go ahead and just automatically give them an eyebrow lift when I'm actually injecting them, so I can prevent any type of eyebrow drop just because they're naturally hooded. So if you look at this patient on the left-hand side, that patient's pretty naturally hooded. And what I mean by that is her eyelids are like essentially her eyebrow is sitting on her eyelid. And when you do that little eyebrow lift, you can see how it opens everything up. So we're going to watch a little video on this. And we treat it like a
The secret to our deodorant is sand. We got a crazy message.
So we treat it like a small muscle group as well. And so you want to make sure that you are injecting superficial and up into the eyebrow, meaning the actual hair. So here's a quick video of Dr. Tim Pierce. Again, he is someone who I love learning from. Him and I inject very similar. And so you can see where he's doing the different types of eyebrow lift techniques. So we're going to watch this video together.
And many of you asked questions on how I was able to inject underneath the eyebrow and not cause an eyelid ptosis. Now, unpacking this is a very interesting way of understanding the anatomy because, of course, we are all very afraid of causing eyelid ptosis. Now, many years ago, when I first started training, I remember training an ophthalmologist who told me that they injected the eyelid close to where I was just warning my trainees to be careful of injecting. And they used 4 units, so 4 times more than I would normally use, and he'd never had an eyelid ptosis. And this really got me thinking much more about the anatomy. So by the end of the show, if you watch it all, you should understand the nuances of different muscles and how they are differently affected to what you may have first thought when you first learned how to inject Botox in this area. So many people were concerned that my injection points were so close to the eyelid that I may cause an eyelid drop. Now let's first consider what actually happens if you inject the eyelid. So people have purposefully injected the eyelid with toxin, and you'll be surprised to find out, if you didn't know this already, that what will actually happen is your eyelid will actually lift. And that is because the superficial muscles that are in the eyelid are actually the protractors of the eyelid. They are not the retractors. So the retractor muscle is the levator pulpebri muscle, which runs in the orbit, and this is what we are concerned about not injecting. Whereas the orbicularis oculi, which actually runs in the eyelid, if you inject that, actually allows your eyelid to open slightly, because when you close your eyes, it's contracting, you relax it, it actually opens. So it's actually the reverse of what many people think, because they haven't thought about where the muscle that lifts the eyelid actually lives, which is in your orbit. So understanding this is the first thing around why you don't need to worry too much around eyelid ptosis. But there are other elements too, because of course we can get eyelid ptosis from injecting superior to the eye. So we need to think about what injections are likely to be causing that and what we can do to avoid it, and why my style of injection in my career has never caused an eyelid ptosis in any of my patients. So that's part one of what to understand. We need to think about which muscles are likely to be involved and what injecting toxin actually does to them. If you're injecting superficially and you inject orbicularis oculi, you will find the eyelids actually more likely to lift. In fact, it's now a treatment for eyelid ptosis when you've injected the other muscle, the levator pulpary muscle. Knowing precisely where these muscles are and what layer they're in will give you confidence to inject in areas where other less thought out clinicians will think you're going to get an eyelid ptosis. So let's think about the layers in this area. Obviously at the top you have the dermis, then you have a thin layer of fat in the hypodermis, and then you have the orbicularis oculi muscle. Underneath that there's the retroorbicularis oculi fat pad, then you have the orbital septum, and underneath that you have the preseptal fat pads, and underneath that you have the levator pulpary muscle. So there are actually multiple layers. So to help you understand this, let's think about the face and the anatomy in this area, not with all the difficult medical terms, but just as a sandwich. Imagine that you're having a sandwich on your mum's favorite tablecloth. That represents the most precious part of the anatomy, the orbit. We don't want to get ketchup on the precious tablecloth. And of course, if you make your sandwich directly on the tablecloth, you're going to make a huge mess and cause your mum a lot of upset. Or your dad. Might be dad's favorite tablecloth too. But what we actually do in real life is you have layers that protect that tablecloth. We have a placemat on top of that. You could think of the placemat as the preseptal fat pads. And on top of that, you have the plate, which you can think of as the orbital membrane. On top of that, you have your first layer of bread, which is the retroorbicularis oculi fat pad. On top of that, you may have the meat, the muscle. On top of that is where we try and put our ketchup. And one layer on top of that is the dermis. So actually, the ketchup is shielded from the tablecloth by multiple different layers. And it's exactly like that with injecting botulinum toxin. We're actually injecting tiny amounts just on top of the muscle, and we have multiple other layers shielding those important structures in the orbit. And it's the depth of injection rather than the position relative to the eyelid that keeps those internal structures safe. Another question that we got many times was, how many units do I like to place in the dots underneath the eyebrow? I find it really helpful using just a 1 unit dose, and this is enough to get a difference. I'm not necessarily trying to paralyze the bulk of the muscle. I just want to affect those fibers that are pulling the eyebrow down. This is also a safer amount. It's a bit like, to go back to our analogy, like using less ketchup. You're just less likely to get an inadvertent mess. So small amounts, wherever you can use them, are always safer. As a general rule of thumb, the dose response curve is less likely to cause you a problem. So that's why I use 1 unit. I typically use 1 to 3 units underneath the brow, and then I'll use my stronger doses where the licensed dose is higher at the lateral canthus. In terms of dilution, I usually use the standard dilution of 2.5 mils in 100 units of botulinum toxin, but sometimes I'll use a more concentrated form if I'm in an area where I just want to make sure there's less chance of a spread. But I used to do that a lot more than I do these days. I've had so few complications that I very rarely use different doses. When I do use the more concentrated version, it's in the lower face. Injecting the depressor angularis oris or the mentalis, I feel safer using a more concentrated dose. For most of the rest of the face, I dilute 100 units with 2.5 mils of bacteriostatic saline. Another question we got was, does the brow lift occur from injecting below the eyebrow or also from injecting above the eyebrow? And in fact, years ago, I had patients who would come and say, no, I've had an eyebrow lift, the doctor injected here, you have to do the same in order to get a lift. Now, if you think about the anatomy, this cannot be true because these are the elevators. And if you inject the elevator of the eyebrow, you're going to decrease the power of that muscle to lift. So you're actually more likely to get a drop. And in fact, most of us are very afraid of injecting directly above the eyebrow in the frontalis muscle because that is where you lose the eyebrow arch. So you only get a lift when you affect the little tug of war that's going on with the eyebrow between the two muscles. One's an elevator, one's a depressor. So if we weaken the depressor, which is the orbicularis oculi muscle, and you can see this because if you want to lower your eyebrow, shut your eyes very tightly and you will see your eyebrow comes down, and that's caused by orbicularis oculi. And the frontalis muscle does the opposite. So the tug of war is won by reducing the strength of the depressor, which is orbicularis oculi, not by treating the frontalis muscle above it. However, the other way we create eyebrow lifts is by increasing the resting tone of the lateral frontalis muscle. And this is done when we treat the middle of the frontalis and the lateral gets more active. So in some of my videos, you'll see that I draw cat ears, we call them, and I tell injectors generally not to inject in those cat ears. Now, those cat ears represent the elevating part of the frontalis muscle. So when I say that it reduces the chance of a ptosis, I'm talking about a brow ptosis, not an eyelid ptosis. And this is one of the biggest confusions that happens earlier on for people, is differentiating between a drop in the eyebrow and a drop in the eyelid. And nearly all of the cases I get sent are actually drops in the eyebrow, not in the eyelid. The actual eyelid is stable, but it's rested on by a heavy eyebrow. Typically, if they have extra fat above their eyes and that's resting, or they have an eyelid shape that just naturally transmits energy into the eyelid, it confuses injectors. But that is all to do with reducing the strength of the frontalis muscle in this crucial area that elevates your eyebrow laterally. So the more botulinum toxin that you place in this area, the more likely you're going to have that problem. And so particularly in females and not so much in males, I don't treat that area because I want there to be an eyebrow arch. Females also tend to use their eyebrows in a different way to men, which is to do with applying makeup. Every morning, if you apply makeup, you tend to lift your eyebrows up, whereas men do not notice the loss of movement laterally. So you can actually treat men quite often with more Botox in the cat ear and weaken the frontalis muscle all the way across, and it does not cause any problem or concern at all, whereas a female will miss that ability to raise their eyebrows and apply makeup. Other injectors were concerned by not treating the cat ear area that you may then cause a Spock brow. And in fact, this could be part of a Spock brow. Typically, I think of a Spock brow as a medial brow ptosis and a lateral brow lift. So if you overtreat the middle and undertreat the side, then absolutely you get this disequilibrium, and you have too much activity and too much heaviness in the middle, and that creates this unpleasant shape. So it is possible that you could be on that spectrum. Like everything we do, you're trying to make the adjustments to get a happy medium. So I want a little bit of a brow lift, not a huge one, and I adjust that sometimes by putting one unit in the top of that triangle of the cat ear, and that's typically what I'll do when I know the patient or when I'm confident that they have quite a strong frontalis. I will treat within the cat ear area. I think sometimes people see these markings and they think it's a definite no-go area. It's actually not. It's just an area that I'm more cautious of injecting, and it's helpful if you know you're creating an eyebrow lift, and if you don't know the patient, to start with leaving it undertreated and then to treat them at a follow-up and then make a note of where that treatment was. So then you have a plan that will work each time you see them. But the first time you treat someone, particularly if they're a little bit older and brow drops a little bit more likely, it just makes sense to see what happens with those units, get the result back in 2 weeks, and then make an adjustment, learn from it, and then you can repeat safely whatever you learn from that patient in the first course of treatment. So I hope that's helped you understand in more detail the three important muscles, particularly with respect to eyelid drops. So we've got the levator pulpary muscle, the orbicularis oculi muscle, and the frontalis muscle. And if you take away anything from this, it's the three-dimensional injection depth that matters most in terms of safe injecting around the eye.
Okay. All right, so any questions on an eyebrow lift, of how it works, what we're treating? I mean, product preference, I don't really have a preference at all. I mean, I will use the exact same product all over the face. He talked about how in the lower face, he will change dilution. I don't recommend doing that. The way that we, teach to inject, DAOs in the lower face, as long as you know that you're in the belly of the muscle, you are fine. You don't need to hyper concentrate anything. So you just use the standard 2.5 is completely appropriate. All righty, let's go back. Has everyone, have y'all started to follow Dr. Tim Pierce on Instagram? He does some really, really great education videos. So, and then over the next week, I have a huge library of education videos that I'm going to be dumping on the main MFL injector only page, like hours and hours and hours of education that y'all are absolutely free to watch. And then I'm going to try to start breaking some of those things down and doing some more advanced trainings as far as like liquid BBLs and décolleté, things like that. All right, let's talk about microneedling. So we did microneedling
Have you heard about
in our training. And in that training, we went over just the basic kind of microneedling of how it works, what types of different serums that you can put on, the different types of microneedling devices. This next video that we're going to be watching, it's over the MD needle pen. This is the exact pen that we use here at MFL. The reason why we chose the MD needle pen versus skin pen or Rejuva pen, any of the other kind of handheld microneedling devices, is because the MD needle pen is specifically used at MD Anderson for skin cancer patients as well. So we really wanted to kind of lean into the medical side of the microneedling device that we chose. And there it is backed by science and it has clinical trials against it, where the skin pen, that is more just for cosmetic purposes. So we wanted to kind of go above and beyond. And so we specifically use the MD needle pen. And this next video is from that manufacturer. One second. And I actually recommend that you microneedle your face as an injector as well. Like every other month to every 3 months, it gives you profound results. There are some patients that actually prefer it to neurotoxins. I like to view microneedling as something that you can adjunct into all of the different services that we offer. So I'll get a patient on a routine of doing their toxin kind of every 3 months. And then I'll either do microneedling or chemical peel a few times a year, just to really, because you have to treat the skin as well. Whenever we are using neurotoxin, that's really just treating the muscles. We have to make sure that we're getting good cell turnover and we are inducing that collagen induction by doing microneedling as well. So make sure that you're taking care of your patient's skin, not just giving them the relaxed look with the neuromodulators.
what is microneedling with the MD needle pen? Microneedling, also known as collagen induction therapy, stimulates the body's natural healing process by creating microchannels on the surface of the skin. This procedure leaves the top layer of the skin intact, allowing for shorter healing time and the ability to treat many different skin concerns. Each microchannel allows for the absorption of serums, hyaluronic acid, and PRP when used during the treatment. The body is stimulated to fill these microchannels by producing collagen and elastin, resulting in smoother, firmer, and rejuvenated skin. The motorized technology of the MD needle pen has the ability to adjust the sterile needles to depths ranging from 0.25 to 2.5 millimeters. These variable depths allow for the treatment of deep wrinkles and acne scars, in addition to delicate areas around the lips and eyes. Microneedling is an effective treatment for many skin concerns, as we can see by analyzing these real-life before and after photos. Before treatment, observe that the acne scars are very deep and pigmented, but after microneedling, the skin is smoother and pigment is diminished. Notice the pronounced smoker's lines here before microneedling. After treatment, the lip lines and wrinkles are minimalized. Here, we see increased skin laxity and rough texture before treatment. Once microneedled, the skin is tighter, firmer, and smoother. See the sun damage and uneven tone in this patient's skin before treatment? After microneedling, pigment is lightened and the skin tone is more even. Notice the brown spots, wrinkles, and skin texture before treatment. After microneedle therapy, aging skin is less crepey with reduced dark spots. Before treatment, we see stretch marks that are very dark and highly visible. After needling, they are smoother and the color is less prominent. Before treatment, there is a noticeable shortage of hairs on the scalp. After skin needling, the number of hair follicles is dramatically increased. Clinical studies have shown microneedling as a safe and effective alternative to ablative laser treatments. With no thermal injury to the skin, a short healing time, and the ability to treat any skin type, it is a skin transformative procedure for every person. Clinical specialists designed the MD needle pen with durable stainless steel outer shell for reliability and gave it the ability to be used corded or cordless for flexibility. The surgical-grade stainless steel needles are individually sterilized for patient safety and comfort. MD Needle Pen is committed to patient results and has developed unique advanced protocols from actual in-office procedures. To learn even more, we have a clinical study underway with Shriners Hospital for Children for the treatment of hypertrophic burn scars. Microneedling is a safe and effective skin rejuvenating procedure that uses the body's natural cellular regeneration to stimulate collagen production. If you are interested in this unique anti-aging treatment that tightens, lifts, and smooths the skin, visit us at mdneedlepen.com or contact one of our local practitioners.
Hey everyone, big heads up, Paleo Valley's running a sale on all their meat sticks right now. You can get 30.
Okay. So with microneedling, we have several injectors that actually they use microneedling, and that's like their primary treatment that they offer their patients. They don't solely focus on the neurotoxins and fillers. They do microneedling and they do chemical peels and they do kind of IV hydration stuff. So please don't feel like you are pigeonholed into just doing one thing. There are estheticians that build their entire brand solely on microneedling. So this is something that you can really kind of push with your patients. And we're going to be coming out with some different pricing that will really kind of help launch microneedling business for all of our MFL injectors. So stay tuned for that additional kind of price stuff that we're going to be working on, and then really lean into this because this is something, it's really non-invasive and patients get really, really great before and after results. Okay, let's talk about our employee. Oh, this was supposed to say discounts. I don't know why. Die accounts. That's supposed to say discounts, not die accounts. Discounts. So please remember that you get 55% off all of your own personal treatments within MFL. Basically, what this means is that you are just paying for the price of the product. Now, you have two options for this. You can either, one, you can inject yourself if you feel comfortable. If you do not feel comfortable doing that, then you can get with a fellow MFL injector and y'all can inject each other. Please make sure you do charge the appointment fee on there. If you don't, it automatically is going to subtract it from it anyways. So please, that way it will you don't get charged twice on that. So make sure that you hit that employee discount, and it is a great benefit of being an injector. So make sure you take advantage of that. Any questions on the employee discount? Yes, ma'am.
Sorry. So if I live in Mississippi and I choose to do the micro needling on myself, can I do it in Mississippi, or do I need to go to Louisiana to do it on myself?
You'll have to do, well, that's a great question. Let me run that by my legal team. I just want to make sure that I mean, obviously it's to yourself.
Right. I wouldn't do it on anybody else.
Yeah. Let me just run that by them.
Okay.
I mean, because ultimately you are doing it to yourself. That I've never had that question. That is an excellent question. I will send them an email tomorrow morning and I will find an answer out for you.
All right. Thank you.
Absolutely. Any other questions? Perfect.
Yeah, I have a question.
Yes, ma'am.
I always have questions.
That's why I asked. Absolutely. That's why
So for microneedling, if they have like one or two pimples, are we just totally avoiding that whole area, or are we pushing them back and be like, hey, why not next week?
I just avoid the area. You just don't want to microneedle over over an infection. So a lot of patients that will have like cystic acne and things like that, or they have rosacea, just make sure you avoid that area because you're going to be putting lidocaine over it too, and then you don't want to drag any type of infection. But if they have like a blemish on their chin or on their nose or their forehead, just don't go directly over that pimple.
Right. Okay. Thank you.
Okay, let's talk about the difference between an enhancement and a finesse. So, a enhancement Essentially, what that means is that the patient just needs more units. Now, this is really where your charting is going to be really beneficial. So if a patient, for example, wants to have their glabella done, and you go to their appointment and you tell them, okay, I'm recommending 20 units of Botox or 50 units of Dysport to your glabella. And you tell them the price and they're like, ooh, that's kind of expensive. I want to dial down a little bit just because of my budget. So I don't want to do the full 5 injections that you are recommending. I just want to do 3. So in your chart, you would go into your chart and say, patient is electing to do less due to budget concerns, which is absolutely okay. However, if they come back 2 weeks later and they're like, I'm still moving, I just, I want to be totally frozen, that's when the patient's just going to have to pay for the additional units versus a finesse is specifically for, let's say you treated the patient's forehead and you did the standard dosing and you did exactly what you're supposed to do, and they still have a little bit of movement, a Spock eye or something like that. That's when you're going to go in and they get to up to 4 units of Botox for free or 10 units of Dysport for free. So that is totally free to the patient. That's to have a little wiggle room for those little Spock eyes or those little brow toesies, so the patient does not come out of pocket for any of those things. But if the patient just needs more because they elected to not do the recommended dosage, then they would have to pay for it. Lacey, yours is a little different with your mom because she actually did the recommended dosing. She just needs more. So we will actually just cover that cost and then we'll adjust her chart for the next time. She's just probably going to need more units in the future.
So I would just basically wait until her 3 months is up and then
You can go ahead and treat her now.
Oh, okay. But would you go like for her crow's feet? Would you go in the same area or would I go further out?
No, you probably go in the same area. Can you send me the before and after of her crow's feet? I thought I just saw the video. Let me look. Looking for you. Thanks. Oh my gosh, I sent that picture to Lacey Harwood. It is a
I was gonna say, I was like, hey, I haven't seen it yet, but I was like, maybe it's not coming through.
No, I sent it to an old high school friend. I'm sure she's like, why are you sending me?
It's fine.
Oh my gosh. Okay. That's so funny. Can you text me real fast, Lacey, so I can pull your, I guess I don't have your number saved. There we go. Okay. Now I'm going to send you your photos. I'm so sorry about that. Okay. So that's the first one. Okay. And then I'll get her and I'll send you these after. So on these pictures, so I'm going to zoom in. This is actually a great example. So I'm going to zoom in so y'all can see. So do you see on her how she has some riders that are going below? So we're going to do, I'm going to mark on here, Lacey, where exactly I think you should inject. However, there are some lines that are a little bit lower. We're not going to be able to treat those. And I'm going to show you where we can't treat. I'm going to do a little dot, this area right here. Done. Thanks for letting us use your mom as an education thing, Lacey.
Yes, I'll have to tell her.
Okay.
Like, oh gosh.
So these areas down here, can y'all see those? We're not going to be able to treat that because it's too low to that zygomatic muscle and it would cause her a crooked smile. But the ones above that, we absolutely can. Okay. And then I'll go on that for you, Lacey, and I'll mark exactly where you need to go to retreat her.
Okay, and then on her forehead, how she still has like, even when she's not smiling, just those lines right there. That's just,
she needs more. And I'll go in on that picture for you and I'll mark exactly where she needs to inject or where you need to inject. Yep.
Yeah.
Yep. And you'll just do those a little bit more superficially because they're so low, but the ones above it look really nice. All right. Any question on the difference between an enhance and a enhancement versus a finesse? Excellent. All right. So for the marketing homework for this week, you're going to follow up with those salons that you've already reached out to. And if you have not reached out to them, this is something that you should definitely start doing salon accounts really are a great way to help boost your business. So this is something that you absolutely can start doing after your launch party. And then you're going to post a before and after of an eyebrow lift. So just a simple eyebrow lift. I have that graphic for you. And then you were going to do one post that you were going to make up this week specifically about the benefits of microneedling. So again, I am just trying to give you additional ideas and the cadence of how often you should be posting and the different types of media that you should be posting as well. They shouldn't all be the same, buy from me, buy from me, buy from me. You need to have some buy from me. You need to have some education, some funny things, and really kind of mix it up because ultimately you are trying to create a brand on social media of who you are as an aesthetic injector. And then you're going to continue your social media following and add to your library of people that you follow. Remember, I want you to be a sponge, learn so many different ways to inject, learn all the different modalities, everything that will give you the tools needed to make you a better injector in the future. So these are 2 more injectors that I recommend you following. Again, they do a lot of advanced techniques. And so it's just a way to get familiar with all the different things that you can do with neurotoxins and fillers. And that is going to be it for this week. What questions do y'all have for me?
I have a question. So my thought process with the IV hydration and stuff.
I'm sorry?
So with the IV hydration, I was wondering, I think I kind of talked to you briefly about it, about having a stock or maybe just like 2 bags.
Sure.
Because I'm like, if our cutoff is Wednesday at 2 p.m. and since I'm like north of Boston area,
Yeah.
I think weekends could be
Pretty big.
potentially bigger for me. But I'm like, if I don't have any supplies and then I can't get it till possibly
Absolutely.
Tuesday. So how do we go about that?
Just order it from Stephanie.
Just say I like without having an appointment or anything.
Yeah, just say I have, I have 2 potential, patients this weekend, which you might, and that way you can at least have, 2 bags on you. That's totally reasonable. We just ask that someone
Okay.
order 30 bags and they have like
Sure.
3 bags of IV fluids on them. But yeah, I mean, it's totally reasonable. Now, the vitamins do expire, so you do need to know that, and they expire within 30 days.
Okay.
So just do need to be cognizant of that.
Anything, I'll tell my husband he's getting an IV and he's
Getting an IV, buddy.
That's right. I'll get it done.
Yes, absolutely.
Okay, cool. I like that. Thank you.
Yep.
Okay, I have one more.
Yeah.
So for if they have a history of cold sores for microneedling, we need the Valtrex, right?
Yeah, I always call
Okay.
it in for them. Now, it's totally up to the patient if they don't want to fill it. But anytime I'm doing anything around the mouth, I just call it in for them. Your telemedicine provider can absolutely do it for you as well.
Okay, and then as far as how they get it, is it something we give to them right there at the appointment? Do they have to go pick it up at a pharmacy or?
Yeah, no, it gets called into their pharmacy and they can pick it up later that
Okay,
day.
and so they use their insurance to pick it up?
Yeah, no, yeah,
Okay.
we don't, yeah, it's just like calling in an antibiotic or anything for the patient. Yeah, it's their
Okay.
responsibility to pay for
And
the.
then if they say, no, I don't want it, we just document it or?
Yep.
Okay, all right,
Absolutely.
thank you.
Hey, Anna, I have a question.
Yes, ma'am.
Alrighty, I finished, thankfully, this week. I completed 8 talks. How do I yes. And I just launched on Sunday, so thank you. How do I move forward with getting filler? I have candidates already lined up.
Absolutely. So, remind me where you are located, Serena.
I'm in Houston.
Excellent. So you're just going to send me a text message and you and I will connect and you'll bring a patient and you'll inject in front of me one other time and you'll be good to go. Your patient will pay the model fee. So it's the flat 125 per syringe.
Okay, so just one person, bring them to you. We'll work that out. Awesome. Thank you.
Yep. So text me whenever you're available and we'll get you signed off.
Yes, awesome. Thanks, Anne.
You're welcome. All right, guys. Well, if y'all don't have any other questions, I will let you enjoy the rest of your Sunday and I will see y'all next week.
See you next week.
Hey, and quick question.
Oh,
One more.
Yep.
No, I did notice when I went back to look at my mom's account. So on one of hers, when we did one of her rainbows, I put 5 units instead of 2.5. I think it was just like the tapping.
Mhm.
And then on one of her glabella areas, it was 2.5 instead of the 10.
Okay, that's
He's
all right.
missing 5 units.
Okay, that's okay. Just be cognizant of it moving forward.
But how do I go back in and fix it?
You can't.
But you,
Yeah.
okay, I'm sorry.
No, oh no, it's okay. I
I
mean,
know, but as I was like, how much did I do? That way when I'm texting you, and then I was like, crap, that's not even the right dose right here. And this one was
that's okay. That's
a
all
little
right.
bit high. Okay.
Be cognizant
So
of it moving
I
forward.
figured when the chart goes off, he's gonna send something back, but no.
I mean, he might. I mean, that we have it's like within like 10 units of Dysport, that we kind of give you a little bit of wiggle room, or 4 units of Botox.
Okay. All right. Thanks, Anne.
You're welcome.
Bye.